So let's now zoom out and talk about our neighborhoods. What makes a thriving neighborhood? A thriving neighborhood makes a thriving community. A thriving community makes a thriving city. A thriving city makes a thriving economy. So it all starts coming back to our people. So we're going to ask our panelists to give their name and title as an intro. When it gets back around to me, we'll get to started. So we'll go first to you.
Good morning. Pastor John Faison, Senior Pastor of Watson Grove Baptist Church and co-chair of Imagine Nashville.
Okay, great, it's working. Hi, I'm Erin Hafkenschiel, and I'm president of ThinkTennessee.
Good morning, everybody. I'm Shubhada, Jagasia. I'm the president and CEO of St. Thomas Hospital, including both of our Midtown and West campuses. I am honored to be on the NashvilleHealth board, and I am an endocrinologist by training.
Good morning. I am Katina, and I am the Chief Executive Officer with Matthew Walker Comprehensive Health Center.
All right, wonderful. And we've been asked to make sure we keep our mics a little bit close because they are recording and we want to be able to share this out. So, Erin, I'm going to start with you. ThinkTennessee reports that...
Your mic
Well, yeah, it is. ThinkTennessee reports that when it comes to GDP growth, our state is one of the best in the nation. At the same time, at the individual level, median household income and cost-burdened households have worsened. How do we begin to address these competing dynamics?
Yeah, thank you so much for that question. And Mark is referring to our state of our state dashboard and our state of our counties dashboard, where we rank Tennessee against peer states, and then we rank all 95 counties against each other. Not as a measure of competitiveness, but more to sort of see where we're doing well and where we're falling behind. And it's not just GDP growth where we are booming. Of course, population growth, job growth, we're sort of off the charts compared to our peer southern states. But when it comes to individuals and how individuals are faring, Mark mentioned a number of them, we are really far behind. Across all of the debt indicators, student debt, medical debt, auto loan, delinquency debt, we are in the bottom 5 states in the country. And as Mark mentioned, thinking about cost burdens, there is only one county in the entire state where the average wages are higher than the average cost of living. Can anybody guess which county that is?
Oh
boy. Williamson. There may be a couple Williamson residents here. There's a lot of, Nashville often is sort of seen as like the thriving county that we need to target. I think we should redirect that energy towards Williamson County. So I think one thing that's really important is that as a state and as a city, we have focused a lot on attracting and incentivizing jobs, moving to Middle Tennessee, moving to Tennessee, and that's great, but we've put almost minimal requirements on the quality of those jobs. Most of those incentive dollars, the requirement is that the job meets the federal minimum wage. That's it, which of course they're legally obligated to do anyways because it's a federal law. And just to remind you, the federal minimum wage is $7.25. I think all of us in the room know that you can't survive in Nashville on $7.25 an hour. So I think it's time to rethink what types, not just from the incentives we're giving, but the types of jobs we want to have here in Nashville, and that job quality is more important than just having a job.
Thank you for that, Erin. And in the spirit of talking about the job quality portion of it, so Dr. Jagasia, in the first panel, we heard David Deal talk about his workforce, which is really spread out, all over the nation. Your workforce at Midtown and West is really in the heart of Nashville. Having said that, same thing, when people tend to talk about a hospital operation, they think about the patients, but in this regard, you can't do anything to the patients if you don't have the right team. So having said that, with these issues of affordability that Erin has brought up, how does the fact that housing, transit, a rising cost of living, how does it impact your team overall?
Great question. And obviously it has a tremendous impact. So let's step back a little bit and look at our Nashville workforce in healthcare. We have 3 large healthcare systems that are working such that we have roughly 2,500 inpatient beds within a 8 to 9 square mile radius, which is really unheard of anywhere else in the country. So suffice to say that we are all competing for the same workforce many a time, and we all remember the pandemic and the cost and toll that it took on healthcare staffing. And we've been left with nursing and other shortages for a period of time. Fortunately, we are in a much better place now, but there are still skilled workforce gaps that we are constantly trying to fill and ensure that our patients are getting the best care that they possibly can. So when we have our workforce with all the gentrification and the cost of living and the housing costs in Nashville start moving out more into the periphery, that truly increases their distance of traveling, it increases costs of traveling, they're spending more time away from their families, leading to work-life imbalances, more burnout, challenges with retention. And then we also have a portion of our workforce that's very dependent on using public transportation. So when we have bus routes that are either inconvenient or they're unreliable, then our workforce is getting to work late, or their absenteeism is increasing. The capacity to hold down a job consistently is a real challenge. And so we have to kind of take into consideration all of these triggers that add on an already stressful work environment where we're literally dealing with life and death on a daily basis. And so really trying to right-size that. Also, as you all heard in the previous panel, we have a multi-generational workforce. So we need to think about all of these components and how they affect each part and segment of our workforce. So for working moms and dads, healthcare access and availability closer to work or closer to home is another challenge, which really adds to the complications of us being able to both recruit and retain a skilled workforce successfully.
So thank you for that, Dr. Jagasia, because at the end of the day, to the point that Dr. Henderson made, the shift starts when they get up in the neighborhood they're in, and then it continues to how they get back to that neighborhood. So keeping that neighborhood context going, Dr. Faison, Watson Grove Baptist Church is located in the historic Edge Hill neighborhood. You have a food pantry there that delivers at least 200 pounds a week of food. What's happening in Edge Hill that makes that food pantry necessary?
Everything that's happening in the city. Edge Hill historically was, I'll go back to the 50s when we moved to Edge Hill. We were actually founded in Una, Tennessee in 1889 by formerly enslaved Tennesseans, but moved to Edge Hill in 1954 because at that time it was in affluent African-American neighborhood. Filled with dentists and doctors and business owners and funeral home directors and professors from TSU and Fisk. But just like many parts of the city, the shifts and changes from suburbanization to the Hope 6 approach to public housing, cordon, concentrated pockets of poverty, cut off from access, transportation, and education and health care, all the way to, many people talk about what happened in North Nashville with Highway 40. Well, 65 did the same thing in South Nashville. And this confluence of factors end up shifting Edge Hill into probably the late 70s, early 80s, and 90s, the hood. And low income, high crime, and all of these challenges that come over time. And all of a sudden, Edge Hill got popular again. Somewhere around late 90s, early 2000s, people rediscovered Edge Hill. And property values began to skyrocket. Long-term generational renters were pushed out. And you see gentrification at its worst. And so today what you see in Edge Hill, it used to be 79% African-American, 17% white. It is somewhere around 46% African-American. You'll also discover that the median housing cost in Edge Hill is about $900,000. But 50% of people in Edge Hill, residents, make less than $42,000. The math is not mathing. And as a result, you've got folks who are choosing between housing and food. You got people making decisions about health care and how they take care of their children. You've got people making these decisions because the environment has forced them into that. So a food pantry then becomes, in a gentrifying neighborhood, a necessary element to catch those who are falling through the cracks. So that's part of what we're seeing. But you also see it with seniors, and we talked about affordable housing and all the elements that have been mentioned today. I'll give you an example. If you have a senior elderly couple who may have built their house in Edge Hill in the 50s or the 60s for $80,000, $90,000. The neighborhood is changing. Their friends have left or passed away. Their children may have moved away, and now they're living in a rancher that's worth probably about $325,000 for the dirt. But they are being forced and pushed by predatory realtors to sell their home. Belmont's going to take your home is one of the edicts, or Vanderbilt's going to steal your home is one of the ways that they intimidate folks into selling. Well, if you built it for $80,000 and you get offered $180,000, it seems like you got a deal until you discover there's nowhere in Edge Hill you can live for $180,000. If you decide to stay, you've got tall and skinnies on both sides. Well, most of our seniors are on fixed income. They don't run their electricity during the daytime. They use the sunlight. Put up tall and skinnies around them, they've lost their sunlight. Now their budget is busted because they have to run their electricity during the day. These are the kind of things that you see in a neighborhood like Edge Hill, stories that aren't being told, but make things like food pantries and advocating for seniors necessary.
That is a wonderful kind of a cross-section of, from a time standpoint, a chronology standpoint, about how economic vitality can change. If it can change for a neighborhood, it can change for a city. Katina, let's kind of keep that same point and come to North Nashville. So Matthew Walker Comprehensive Health Center is in the center of North Nashville, but how is the economic vitality of North Nashville tied to the ways that your team has to care for the residents of that same community?
Sure. And so it's just as Pastor Faison described for the Edge Hill community is what has happened in North Nashville. Definitely we have heard the scarring of the community for the insertion of the interstate through that community, in the ripping away of the wealth that had been in North Nashville for centuries, for generations. And so now what we see is a community, in my opinion, that has been left behind, that has been seen for its assets when it is useful for individuals that need to come in closer to the city. And so, yes, we're all excited about the growth of North Nashville, or Nashville in general, but North Nashville is not reaping the benefits of that growth. And so we recently lost our Family Dollar, which is a couple of blocks from the health center, which was a source of food and supply for individuals in that part of North Nashville, particularly older adults that cannot get all the way down Jefferson Street to the other Family Dollar. And so now what will we have are people that will have a lack of food, who will need additional resources, and we are right in the center before they get to the next Family Dollar. And so we also have a food pantry. We also provide resources and supplies for individuals because access to those is very hard. And so I know for us, I look at this room and we're a well-resourced room of people, right? We all drove in, we all struggled with the traffic, we all got mad at the valet because it was full. But could you imagine that be your daily grind? That's what you have to do every day just to get to the grocery store? That's what you have to do every day just to get to the doctor? We really, be honest with yourself, we take it for granted because we can get in our car and we can go where we need to go and do what we need to do. If my parents lived in a home that was surrounded by tall and skinnies and now they're cold during the day and they have to run their electricity and now we have to figure out how to pay that electric bill, now I'm aggravated. And so the economic vitality of North Nashville, since I've been here, I'm not a Nashvilleian. I've been here long enough that I should be. Is there a card that I can have to say that I'm an honorary Nashvilleian? But ever since I came here, I have just been flabbergasted about the differences between the vitality of Jefferson Street and the vitality of West End. We have almost the same things. buildings. We have 3 thriving universities. We have businesses that run up and down that street every day, and yet we struggle with simple things like abandoned buildings and access to food and supplies. And so there is a difference in what people in Nashville are experiencing in terms of the growth that is happening in this city. And so, yes, I applauded, and I leaned over to Pastor Faison during the first one, and I said, I feel like our panel is going to be have a different perspective about what's happening in Nashville. I applaud the growth, but the economic growth is not reaching all of the corners of our community.
So, Katina, let's stick with you on that point and let's tie something together to that. We're talking about neighborhoods that our prospective teams live in. First panel was talking about it from a workforce standpoint, but let's kind of put it back in the context of this panel to your point. So shift-based employment is far more prevalent in these neighborhoods than they are in some of the neighborhoods that don't experience some of these things. That compresses your time, it compresses your ability to take care of yourself, it compresses your ability to be a caregiver for somebody else. How has Matthew Walker had to respond to that dynamic?
Sure. I always tell people our shift-based employees will be in the negative trying to take care of themselves, trying to go to the doctor. So you take off work, you don't have any paid time off, so you're not going to get paid that day. You have to pay whatever cost you have to pay to get to the doctor, be it your gas, a bus ticket, however that is. And so now you've expensed that. Then you have to pay for the doctor visit. If you have insurance or not, probably you have to pay something. And then you're probably going to need a prescription that you got to pay for. So if you think about it, you've really gone in the negative that day of trying to take care of yourself because you started off not getting paid. Again, we all will get paid to take the day off. We probably get incentivized to take the day off. And so we have Saturday clinics, so that our community individuals that work shifts during the week can still have access to health care. We also have a mobile unit that we use to partner with various agencies to do, as Dr. Henderson said, to pull up with the health care. We don't pull up with the mammogram quite yet, but we will pull up with other sources, with vaccines, with well visits, with adult well checks, so that people can stay healthy. It's a choice that people have to make between being healthy and providing for their families. It had been for years that we talked about people not wanting to get screened for cancer because they could not, in their mind, afford to be diagnosed with any type of cancer. It just was not, the math wasn't mathing in that either. And so they'd rather just work it through. And so now that position has changed, and people are interested in being screened and having the information and having the education. And Matthew Walker is there to be that bridge when they are not able to come Monday through Friday.
Thank you, Katina. Dr. Jagasia, let's come back to you. Often when the general public thinks of wellness and well-being, they think of a hospital system or healthcare. In some ways, it's actually unfair because when someone presents to the hospital, a lot of the times it is an acute representation of what's been happening chronically in their context for a long time. But in some ways that we're formulated from a hospital standpoint, it falls on the burden of your care coordinators and your case managers to deal with these things that really aren't healthcare related, but they really are the chief things that catalyze the fact that you have to deal with that acute outcome. Having said that, what are some of the non-medical determinants that your team deals with that really are not the responsibility of the hospital, but at the end of the day, you have to deal with it because it's in your building?
Yes. I think I'll kind of step back and answer this from a physician's perspective. Very early on in our training as physicians, we realized that the contact that the patient has with us, either in a clinic or in a hospital, is but one small sliver of that entire patient's healthcare journey. And when the patient leaves us, there are social, economic, environmental factors, what we call social determinants of health, that really contribute to almost 80% of health outcomes for that patient, whether it be positive or negative. So when patients access us at that one moment in time, we take into consideration all of the various components of that patient's care, because our mission at St. Thomas Health is to provide spiritually centered, holistic care. So though we are responsible for that episode of care, we are trying to do right by our patients and understand and name all the components that serve as a challenge for that patient to really receive optimal care. But essentially, if I was to name all of them at this point, Mark, it would be the entire list of social determinants. But I'll just call out the top few. So I think being uninsured or underinsured, lack of access to primary care or specialty care. We have patients who have a lot of job instability, which leads to economic instability and challenges with medical bills and so on. Mental health, we all know, is a rising incidence and something that we just don't have enough access to care for. Substance misuse disorders. Oftentimes patients the trigger will be something that's stemming from substance misuse, and that's when they present to an acute care hospital for care. Then we have to consider things such as transportation that we've been talking about, transportation difficulties, having food insecurity, which we've touched on, housing insecurity, having health literacy problems, right? When we send a patient out, we are seeing patients when they're sickest, they're most vulnerable, and I think every one of us has had an interaction with a healthcare system at whatever stage that we walked out of there going, did I understand everything that was explained to me when I actually left that space? So you can understand when you put a sick patient in that space without adequate social and community support, what does that patient actually experience? So having health literacy issues. Also, as our community is diversifying in various ways, we have cultural competency challenges. We have language barriers, which really affect the way a patient understands what has been said, perceives it, and actually executes on something that is going to lead to long-term stability of their health.
Thank you, Dr. Jagasia, for that. To the point of non-medical things that occur that then healthcare professionals have to engage when they're with those patients. Erin, I'm gonna come back to you. Housing, and I can give an example. A lot of people don't think of this, but we have maternal health issues in terms of before pregnancy and even postpartum. One of the chief things that actually is a relief to that is housing stability throughout the pregnancy and housing stability after it. Erin, ThinkTennessee is really on a campaign around housing across the state to include Nashville because of the recognition that if you're not stably housed, if you're not in a quality house, there's very little you can do to get relief from that and to have a thriving mindset. So as housing is a critical determinant of health, what policies best address housing instability and its downstream impacts on well-being?
Yeah, thanks, Mark. So before I jump into the housing piece, one of the reasons we focus on housing, we're very data-driven at ThinkTennessee. We look at the expenses that impact households the most, and the four most expensive expenses for households in all 95 counties in Tennessee are housing, transportation, childcare, and healthcare. So we're going to zero in on housing because that's a huge issue here in Nashville, but I'm sure we'll talk about the cost for all the other ones as we get into it. So I'm sure a lot of you in the room have heard the stat from the Robert Wood Johnson Foundation that your zip code determines your health and life expectancy. And housing is hugely related to those health outcomes. I'm borrowing this from the Tennessee Department of Health's Housing and Hospitals in Tennessee report, but they look at the intersection of health and housing across four different categories. The first is housing instability and homelessness. The second is physical housing quality. The third is housing affordability, which is where I think we spend the most of our time talking. And fourth is neighborhood conditions. All four of those are critically important. And so as we think about sort of how we're addressing the interactions between health and housing, there's just a couple things I want to point out. First is housing quality standards. So Tennessee and Nashville have been significantly behind our peer cities and peer states in adopting improved building codes and building standards. Metro Nashville actually just adopted the 2021 standards, but that only applies to new housing. When I was in the mayor's office in 2016, we had just adopted as a state the 2012 building standards. So we're always pretty significantly behind where a lot of our peer states are. And again, it's a reminder that that only applies to new housing. So we have to be thinking about retrofitting older homes that have a lot of quality issues and particularly energy efficiency. We have some of the highest housing energy burden in the country. The other big important part of that is building standard enforcement. I remember having a conversation with a group of code enforcers across the state. Again, when I was in the mayor's office, I won't quote him, but he said, honey, well, I guess I will quote him. He said, honey, you just have to understand there's a difference between the energy code and the health and housing code. And I think he really misunderstood the impact that the energy code has on health outcomes. But that is a code enforcers across the state think that. They think the energy code is not important to people's health, and so it's not important for them to enforce it. And then the last thing is holding landlords accountable for the quality of their house. One of the ways you can do that is with a landlord registry where there is landlords are, you have sort of a registry that when complaints come in, Metro Nashville is able to sort of find those landlords and get them to make those improvements. The part of it that makes that most effective is preempted by the state of Tennessee. So we can't do that here in Nashville without a change at the state law. And then just the second thing I would pick up on is, which is where ThinkTennessee has been focusing. Another area where we're preempted as a state is we can't do mandatory inclusionary zoning, where if there is a development that's happening, let's say there's 100 units, you can require that 20% of those units are affordable. This has many impacts on our housing market. One of the most important ones is that when you have a bill like that in place, it creates a market for affordable housing and affordable housing developers, which means that we have a robust network and market of affordable housing developers that know how to build an affordable housing project. They know how to finance it, they know how to get it done, they know how to go through the permitting process. Without that market built in, our affordable housing developers are just not as they don't have as much experience as affordable housing developers in other parts of the country. And that's a big part of what's missing here. And so ThinkTennessee has taken the approach of thinking about neighborhood anchors and institutional landowners like churches, like healthcare institutions, like sports stadiums, where we can really sort of catalyze these conversations around building more affordable housing closer to where people want to be.
We keep hitting on a point between the first panel and the second panel about where people live and how their day starts and ends before they even get to employment. Dr. Faison, I've heard you say that Nashville is at a tipping point, an inflection point as it relates to our growth. Erin just explained why some of those things are foundational to lead you to that statement. Expound on that for the audience in terms of the tipping point, the inflection point.
Sure. Anecdotally, I believe that. But imagine Nashville, the process that we went through gave me data and concretized that assumption. Imagine Nashville was a community-led, community-wide survey effort for us to come together as a city and to plot out and think through priorities and values for the next 10 to 20 years. We were able to reach 10,000 plus residents in about 100 days, to hear from folks all over the city. About 10% of that plus 10,000 voice effort were kids, 12 to 18. So we heard from their concerns. We heard from, again, every corner of the city of Nashville. And what we discovered is while growth is happening, it's a common refrain. While growth is taking place, that growth is not touching certain areas, certain demographics, certain regions of Davidson County. The tipping point is this. If we do not, in this moment, seize the opportunity to make sure that the net is cast wider so that everyone in the city begins to enjoy the benefits of the growth, the tipping point is that we have the potential of creating an anti-growth sentiment. And the anti-growth group and sentiment can become so large that it starts to chip away at the growth. And we become an unattractive city. We become a city where businesses and developers don't want to be a part of because of all of the negativity around their efforts to impact and increase growth. So the tipping point is, if we don't get the city as a whole impacted by the benefits of growth. It's not a statement that growth is bad. It's a statement that everybody's not enjoying it. And when that happens, you create this backlash. And we're close. We're there.
So staying with you on that topic, and I would encourage everybody, it's open source, the Imagine Nashville survey. You can, Katina, you're a part of that group as well. You can access it, and it has really, really meaningful data from a respondent standpoint. How can we use that data, Dr. Faison, in a way that actually is an opportunity for the future? And to be clear, all cities have some version of these problems. Us talking about them actually puts us in a position to be able to actually engage them and go forward. But having said that, what are some of the highlights that you think give us an opportunity and a window to collaborate and move forward in a positive way that prevents what you just said from happening?
Sure. We are not defeated by a preponderance of issues. We are defeated by poverty of imagination. That we dream big, but we don't dream wide. We don't create spaces, entry points for persons who have been historically excluded and left out. So while we dream big, all of the faces in our dreams look the same. Right? So I think that this Imagine Nashville data, my co-chairs, myself, Dr. Alex Jahangir, and Renata Soto, we see this as a gift to the city. It is solid, reputable, credible data. It is also the largest survey that's been done in the city of Nashville probably in the last 20, 30 years. So it's up to date. It is pregnant with potential. It is absolutely pregnant with opportunities. And organizations already are seizing the data and mining it. It not only gives citywide information, but it also gives zip code information down to neighborhoods, what the needs are, what people believe. So it's this swath of information that people are using to apply for grants, and people are using to build proposals, and people are using it to kind of substantiate their efforts to shift some of the conversations in the communities that are happening. I also believe, you heard from 10,000 residents, it's hard for elected officials to say they don't know what people want when you have the data that tells you what people want. It gives citizens now the leverage to hold political candidates and political officials accountable. This is what we need. Now you have the choice to respond or to ignore it. But you can't say you didn't know. It is this turning point, I believe, in our city at this tipping point. It gives us an incredible window of opportunity to really begin to address some of the concerns and the issues that are present. So I believe that our best days are in front of us. But to get to our best days, we got to address some of our worst issues.
So let me just lean in right here as a part of this committee and say that if you haven't read the report, you should read the report, because what it says is that our communities want the same thing. They want their children to have a safe place. They want their children to have an opportunity to succeed, and everyone wants to feel like they belong in this community. And if we leaned in on just those things, the lack of economic mobility that we are experiencing in our communities would improve. I think that that's one of the parts that we don't talk about, is that we have generations of families that have been in poverty, and it's not for their lack of want or trying. I want us to be clear. We are not talking about what we see on TV of people who just can't get themselves together. No, one one illness, one broke down car, one job that didn't go well, and people are now shifted into a different position. And so the Imagine Nashville report shows us that you're right. We dream big based on certain things, right? We dream big because we see certain stars or dollar signs. We need to dream wide if we want our entire community to rise and to be better. And trust, if we can economically mobilize our communities, it will have an impact on everyone positively. Yes, the poor will be with us always, but they ain't always got to be the same poor people. I mean, I just feel like we can change that. We can change it.
Katina, let's stay with you for a minute because you're part of Imagine Nashville. It has these respondents, and it's really speaking to folks that are working, folks that are patients. I want to give you the opportunity. So we asked David, Deal, say, hey, how are you thinking about these things in terms of your workers? As Dr. Jagasia, the same thing. When it comes to Imagine Nashville data, it is about, in some ways, to use the word that Dr. Henderson used, like the client portion of it, but it really is also about how your team reflects the same barriers that are in the community for your patients also exist for your team. So from a managerial standpoint, how do you work through, not only am I imagining this for the people that we're providing care for, I have to manage this for my team.
Sure. So let me just put this in context in that our founder, Dr. Matthew Walker Sr., founded us from a model that he saw in Mount Bayou, Mississippi, and that they created a healthcare system that cared for the community in which it existed, and it employed people from that community. And so we do that in each of our sites. We have a Nashville site, a Clarksville site, and a Smyrna site. And so we want to employ individuals that live, work, have experienced that community so they can better understand the patients that we are caring for. But yes, they have the same challenges. When we have an employee that's transitioning from one job to the next, and they are going to wait 2 weeks to get their check, then yes, they may have to visit our food pantry. Yes, they may need to get an advancement on their check. Yes, they may need a different work schedule for a little bit to get their child care together. And so we are patient in those processes because we understand that we are hiring from our community, and we are intentionally hiring from our community because we want to give them an opportunity to have a career path, a growth path. We have started some workforce training programs for frontline staff. We are going to initiate one for medical assistants to give individuals an entry point into healthcare careers without going into some type of debt. And so we are a reflection of our community, and that is a positive, and it's not a positive sometimes. And so as I listened to the panel before, and I even texted my team, I was like, what would it look like for us to become the Hermitage Hotel of community health? Like, what would it look like for us to just be that for our community in terms of healthcare? And so it does cause us to dream a little bigger and a little wider because then everyone, right, is a part of that work. And so, yes, we do employ from our community. We do have our staff have the same struggles in some of our community, not just in terms of food and transportation, but taking care of elderly loved ones, having to leave them at home, to have to come to work, having to deal with the same screening issues we screen our patients for in terms of domestic violence and other issues. And so we're working with our staff through the same challenges that they are trying to work through with the patients. And so it causes us as a management team to really have to balance how we work and how we implement the work and how we move the work forward.
And if I can jump in and just add that cross-sector collaboration is really important in what you're trying to do, right? So it's not any one of us's job to get that job done. It is collaboration which will get us there. So I think a good example of that is the dental residency that Matthew Walker and St. Thomas are creating together, where we are training that next generation of dentists so that the providers that are caring for our patients are looking more like our patients, and they are providers that our patients can easily relate to.
So Dr. Jagasia, that is a great segue to the next question, which will be yours. Everything that we're discussing, that we've situated well, what the challenges are. Let's make opportunities out of these challenges. And whatever opportunity there is, it would not be one if it not for collaboration. It's going to always come back to how can we have a collaborative ethos in Nashville that we own? Because if we are the healthiest city at the same time as the economic vitality that Erin described, there would be nothing to stop this from being a place on earth to show people how you can truly do this. Having said that, let's talk about from here on out like the opportunities and some things and examples of things that have gone well, so we can give people something to stick to. Say, if you want to invest in something, if you want to pay attention to something based on these issues or these challenges and opportunities, this is what we should do. Dr. Jagasia, give us a good example of, you already gave us an example with Matthew Walker and the dental program, but the fact that you're partnering with outpatient entities as an inpatient entity that also has outpatient to make sure that continuum of a patient journey is more whole and less fragmented. Give me a good example of that.
Yes, so at St. Thomas Hospital, we take our women's care very seriously. We deliver roughly 7,000 babies on an annual basis, and 1 in 5 Middle Tennesseans is born at Midtown. And so our women's care and our outreach is really important, and we want to be mission-driven in everything that we do. So we want to be able to provide that holistic care irrespective of the patient's income level or, as we've discussed, life circumstances. And so a good example of that in our maternity space is the work that we are doing with Neighborhood Health and with Connectus. Both of these are essentially primary care medical homes and federally qualified health centers where we have patients from all walks of life, a significant immigrant population or underinsured, and also patients with TennCare, because not every OB provider in our city actually accepts patients with TennCare. And so what we do, Connectus, for example, is a great example of our cross-collaboration and seamless transitions of care, and most importantly, access to healthcare information through the EMR or through community health workers who we engage in this work along with the Connectus group. There is collaboration at every level of our partnership, starting, I think at the end of the day, as leaders, everything starts with us. So we collaborate with Connectus Health to understand how they provide care. They manage everything starting from preconception to conception, all the way through till they need acute care services within the hospital. That acute care service might be at the time of delivery, if you're young and healthy and have had no complications in the pregnancy, or it could be sooner. We have specialized obstetrics EDs and GYN ED at our Midtown campus. So patients come in through those locations. Our Connectus midwives actually work in our hospital closely with our laborists. If they need complication care during pregnancy, they have access to highly specialized maternal fetal medicine doctors who collaborate and create plans of care which everybody is aware about. There is no fragmentation in that care, which is a key component of successful outcomes at the end of the day. And we also understand that there are other needs outside of that healthcare journey that the patient has. So for instance, we contribute and jointly work on a food pantry, which is at Connectus Health, or a diaper depot. They have clothes for children up to the age of 10. We have our Ascension St. Thomas Foundation, which supports some of the care. We provide financial assistance when needed. And then we also have additional sources of support that we can provide patients that need it. I spoke about cultural competencies and language barriers. An immigrant population, especially during a pregnancy, especially if it was a first pregnancy, is a time of significant support that the mother needs, especially if they don't have any social or community support. So we are cognizant of all of these components, and together we've really been able to create an example of a true collaboration across the hospital walls, because at the end of the day, we are only as successful as we can be working together.
Collaboration really is the key. So Erin, your purview is the state to include, Nashville and Middle Tennessee. But what are some community-driven initiatives that have successfully improved quality of life in Tennessee? And how can those models, inspire an optimism that people can actually look at them for either replicating them or scaling them? But just give us a sense of that.
So I'm going to take a little bit of liberty and talk a little bit about why the neighborhood level is so incredibly important. I want to go back to the Imagine Nashville survey, because one of the questions in the Imagine Nashville survey was, what do you want Nashville to be? Do we want to be the high-tech innovation center of the world? Do we want to be the healthcare capital of the world? Do we want to double down on Music City? And the vast majority of the respondents said, we don't really care about that. We care about our neighborhoods. And we want to be a city of thriving neighborhoods. And what I loved about what Dr. Jagasia said around cross-sector collaboration, I want us to rethink about our neighborhoods. Successful, thriving neighborhoods are where you have cross-sector collaboration in real life, in the built environment. And so when we're thinking about a neighborhood that only has homes in it, that's not going to be as thriving as a neighborhood that has access to healthcare, access to grocery stores, access to jobs. So I love that cross-sector collaboration in a neighborhood, thinking about it that way. And I just want to share two really important stats related to this, because I think a lot of people don't understand how walkability and access to transit at the neighborhood level drastically impact a family's well-being. So again, I know the crowd I'm speaking to. I know a lot of the people in the audience are probably familiar with the longest longitudinal study ever done that Harvard has done over decades and decades. What you may not know is that commuting time has emerged as the single strongest factor in the odds of escaping poverty. Not income. Commute time. Of course, those two things are correlated. The longer an average commute in a given county, the worse the chances of low-income families moving up the ladder. Another study looked specifically at walkability as measured by walkscore.com, and the more likely Americans whose parents were in the lowest income quintile are, if they've grown up in a walkable neighborhood, the more likely Americans whose parents were in the lowest income quintile are to have reached the highest income quintile by their 30s if they grow up in a neighborhood that's walkable. If you can walk to school, if you can walk to the grocery store, if you can walk to your first job, you have a higher chance of being in the highest income quintile by your 30s. So walkability and access to opportunities is just hugely important. So I wanted to get those two stats in because I'd written them down in my notes. So two super quick examples that I'll talk about. One, of course, is the Barnes Housing Trust Fund. That's a model that we have here in Nashville that we share with a lot of our peer cities. And then the other one I want to talk about is, Mark, from your hometown, is the Memphis Medical District Collaborative. And I think that this is a really, really important model that we should be thinking about here in Nashville, particularly in Midtown, given all the hospitals we have in Midtown. And Mark, you could probably say this better than I can, but the Memphis Medical District Collaborative has worked together on creating really successful tactical urbanism projects to improve the streetscape, improve the quality of walkability. They're doubling down on a new bus rapid transit corridor, the Memphis Innovation Corridor. They've worked together on workforce development and affordable housing projects. So they're saying they may have started it because of a workforce issue, but they're saying we want to create a high quality neighborhood, and that's what's going to make us successful as healthcare providers. And so I think that that's hugely important to all the neighborhoods we're talking about: North Nashville, Midtown, and Edgehill. Yeah,
I appreciate the hometown shout out. Daryl Cobbins and Brandon Ingram came up here from Memphis, and they are critically aware of the Memphis Medical District collaborative and effort. So we're going to end on this particular note. I don't know if Marjorie Pomeroy Wallace is still in the building. Kendra, I know, is afterwards from the mayor's office. This is going to be a voting, kind of a thing that we're going to talk about now. You set us up really great for that with a commuting comment, okay? So we are now voting on a transit referendum. How can that be a catalyst to getting to the point that you're talking about, lower commuting times and not having some of these challenges? And I want each of you to talk about why you think this should be supported. Dr. Faison, we'll start with you.
I think it's important, particularly for low-income citizens. We talked about about 47% of those who responded to the Imagine Nashville survey made under $50,000. So we're talking cost burden, we're talking commuter time. There are folks who run the city They are the lifeblood of the city, the services, all of the amenities, all of the things that we enjoy in our city, and they can't afford to live in the city. They run, right? So they end up in the outskirts. They end up in surrounding counties. I remember moving here in 2012 and moved with 3 children. And I remember living in Antioch for 3 years, then moving to Mount Juliet for a year, then buying a house in Lebanon for 5 years, then coming back to Hermitage and going to Antioch because it was cost of living issues and education, right, for my kids. This referendum has the potential to knock some of the haziness around people's ability to get around the city. Answer a lot of questions because they're predictable routes, and they know they can get here. They know they will get here at this time. And this is vital for low-income citizens. I'll speak as a pastor. I pastor in Edge Hill. We have a campus in Franklin. My growth strategy for my church is built around the transportation challenges in Nashville. I can't build a major facility that people will come into because most of the people who attend my church can't afford to live in the community. So they come from other places. So we have a multi-campus model that we have to accommodate in order to reach the folk we're trying to reach. So I see this from my staff having to commute in. I see this from members. I see this from community members, folks who work and lead the library across the street and work at Belmont and work at Vanderbilt or Vanderbilt United Medical Center. All of those folks that are part of our community are impacted by this challenge. So I think this referendum has a chance to not completely solve it, but absolutely put a dent in it. We're already behind. This is going to help us catch up.
Dr. Jagasia, why don't you respond to that point as well from your point of view?
Yes, so I think well said. I'll agree with and echo those same sentiments. With where we are in Nashville, we've really grown. We've been personally in Nashville 28 years, and it's grown from a small town to a bigger town to now a booming city. And I don't see us making that jump to the next frontier without transportation. Reliable, convenient. Again, it's not going to be a solve all from the beginning, and neither should it be. But at least we're making a move in the right direction so that it's something that will help our community at large from a workforce perspective. It is going to be a game changer for all of us in workforce and for each and every patient who is constantly thinking about, do I spend X number of dollars on transportation and healthcare, or do I feed my children? That is a real decision point in many households right now, and we have to own what we have to do as a city to be able to ensure that the advantages of all the growth are such that all members of our community thrive with it.
Katina, and then Erin will let you complete this.
So I've been sitting here trying to collect my thoughts on what I want to say. I think that if you drove here in a car, you have nothing to say about it except yes, because you don't know the struggles to ride the bus. I remember having to ride the bus to work. I remember calling home to my mom crying because I could not figure out this bus system. She reminded me I was in a country town, and that's just the way it is. It was a struggle. If you've ever ridden a bus when you're sick, you don't want to have to transfer. You want to get on one bus and get off. You want the bus to come and pick you up at your closest point. When the monsoon season comes and that rain hits, you don't want to have to slush blocks to get to where you are. I live a garage life. I left my jacket the other day and was like, hey, it's cold. I forgot to bring my jacket. You can't do that when you're on the bus. You got to bring it all with you. We had a patient that was leaving our building one day with a baby in a little carrier. She was headed to the bus stop. And it hurt me to know that she was going to get on that bus. And so I turned her around and brought her back in. Our staff got her an Uber to take her back. She was just 3 weeks out of the hospital with the baby. People do that every day. We need a better plan. We need a better transit plan for this city.
Mark, you know I love this topic, so I will try and be as concise as I possibly can. Everyone has touched on it. I'll put a little bit of data behind it. If you live in Nashville, you are required to own a car to get to work. The average car ownership annual cost in Davidson County is now $14,600. It was under $10,000 before the pandemic because of all the issues with being able to buy a car. That average cost is $14,600. If you live in any county outside of Nashville, it's thousands of dollars more. In Lebanon, it's $16,000. In Franklin, it's $15,000. That is a huge chunk of your household budget. And so any opportunity that we can have where people have a high quality system, where you can have dignity in writing it, convenience in writing it, and you can reduce your household costs, that is hugely important for people being able to access opportunities and get to school. So this is like the easiest yes we've ever had, the easiest question we've ever had to ask as a community. Let's invest in ourselves. Let's invest in our friends. Let's dream wide.
All right, so in the first panel, we heard about transit and what we can do. We heard about it in this one. So this is one of the few conferences where you can go out today and say, I actually did something based on what they talked about. It actually gives you the ability to do that. So if you haven't voted already, you got your guidance from everybody that's up here. Can we give a round of applause for this panel?